I can't move the way I used to, had to call the audible. I put in the work, no humble flex. And talk of the town, you see who next. They on checkers, I'm on chess. Had to hit her with the X. Xenhouse.
This is the Xenhouse podcast. This is episode 58.
Your boy.
We're here.
Hey,
5'8", 9 a game.
Ooh. That was your number, huh?
Yeah. What was yours?
5.
What league?
What are you trying to say?
Next.
Wow. Okay. On the Xenhouse podcast, we like to incorporate fitness, community, culture, and merge it with mind, body, and soul. It's your boy, Des Hines.
It's your boy, A. Joe.
Ross B.
Oh, my gosh.
Now, that wasn't bad.
No.
It was better?
He
I'm
did
getting
the
better.
tilt, hands like, who is he?
What you want me to do, Alex?
His eyes.
This dude get a
he's like,
haircut and he wanna...
You change up, though, when you get that cut.
Oh, that's what you do.
This is
huh?
unacceptable.
So you're multiple
My
people.
confidence is at 100 always, but when I get that cut, I'm at like 150.
Okay. So that means you turn into Ross B.
That's it.
Okay.
So I'm at like 90 then.
Be the same
I need
person
a
every day.
Right.
Sick of this guy. Today, guys, we got a special guest. He's from the town. We grew up together. I have a personal relationship with this guy. We grew up playing soccer together. His dad was our coach. He's now working at HSS as a physical therapist, taking care of many people from young to old. Here's Andrew Shannon.
Welcome, Andrew. Welcome.
Well,
my
thanks
man.
for having me
Welcome.
on. Thanks for having me on.
Finally. Right?
Yeah.
I've been trying to get you on here for a while.
I'm excited. I'm excited to talk everything fitness, culture. Really happy you guys brought me here.
That we had to, man. You've got to get a different aspect of the training world in regards to taking care of the human body, the anatomy, and we need somebody else to kind of give their insight. And why not a perfect candidate for someone who grew up in the area, who knows us personally, and you work for a very well-known company.
Yes.
So for you to have your expertise and kind of share it with everybody else, that'd be huge for us. So tell us
Absolutely.
a little bit about yourself.
So as Alex mentioned, I'm born and raised in Stamford, Connecticut. I'm a doctor of physical therapy at Stamford Hospital, HSS Sports Rehab in Chelsea Piers. And like you mentioned, we see patients all aspects of the age range from your elementary school wrist fracture to your geriatric fall risk. And obviously being in orthopedics, having an athletic training background, and having a clinical specialty in orthopedics, I love the sports, fitness, return to sport, injury prevention type patient.
Yeah.
Out of high school, like we all played high school football against each other. We're not gonna drop no stats out, but like, right, in the early stages of your career, of you just being a student, right, just in high school, what drove you to, kind of want to give back and help other people?
Ross, thanks for bringing that up. So I became a physical therapist because I tore my ACL and MCL playing high school football.
Oh, wow.
So back then, before cell phones, or around the time of cell phones, believe it or not, you didn't really know a lot about ACL or knee injuries. So I tore up my knee, had the MRI, you need surgery. So I was kind of like, wait, what? Surgery? I thought I was playing next week. So that was kind of a little bit of a shock because I'm sure like most of you guys didn't really get injured a lot. So this was the first big hit. So anyway, went through prehab. So in the stage between injury and surgery is called prehab. So getting stronger so that your long-term outcomes will be better after surgery. Did that for about 4 weeks while my MCL scarred down, had surgery, and then started over again. So I was like, I was 16 years old at the time, and I was like, oh, I should be able to do this for a profession. This seems pretty cool. Boom. So I was fortunate that I was able to pretty much figure out what I wanted to do for my career
Early on.
Yep. That's huge.
It took something, I mean, it's not a good thing, right? But it
Right.
took something bad for you to kind of gain some interest and being like, hey, like, this is super interesting, and I can actually help other people do well or get better in a process of things. Because in high school, I don't think we witnessed a ton of ACLs or stuff like that, right?
I saw a few, but it was like a mythical thing. Like,
Right.
Yeah.
One thing I never heard of was Achilles injury.
Yeah.
And I'm pretty sure they happened, but
It happens.
I didn't. When he tore his Achilles, I never heard about it. I'm like,
Yeah.
tore your Achilles?
Right.
I was like, you still coming to my party? It was on my birthday. I was turning
Still holding
25,
a grudge
and I
to
had
this
a
day.
party in the city. He was like, yeah, I tore my Achilles. I was like, all right, you still coming? He was like, I
I got
don't think I'm gonna
surgery.
make
I got
this one,
surgery in the
yo.
morning, big
Clearly,
fella.
Dez only cared about himself.
Yo, I didn't give a damn about his Achilles.
Do you remember exactly how it happened? Like, because you played on grass, right? Like Stanford High and did Westfield even have turf? No, they had the different kind of turf. We had AstroTurf.
We had
had-
AstroTurf. They had
It's like when
They
it got a
had
little
those-
bit.
the beads.
You
Right,
guys
and then
had
you guys
the,
had
the,
grass.
con-
The
the
AstroTurf.
concrete
Yep.
block. Of
Oh,
the-
yeah.
Exactly.
Yep.
But you guys played on
grass,
grass,
yep.
right? So
Yep.
do you remember how it happened?
Absolutely. Never forget. So we played at St. Joe's. It was a away game at St. Joe's. They had grass, similar playing surface to ours at Trinity Catholic. Let's go back because some viewers might not know Willis McGahee, but Nick Chubb this year. Remember his injury? How it
Yep.
happened with the hyperextension? That's very similar to what happened to my knee.
Yep.
So right away, with all injuries, especially like traumatic injuries, specifically contact injuries, you know something's wrong right away, right? So essentially had the hyperextension of the knee and boom, sounded like a gunshot, very large pop, similar to an Achilles tear. And to be honest with you, I kind of looked down from what I remember so long ago. When I looked down, I was like, I hope my leg is still attached. Thankfully it was. And, I didn't know the severity of the injury because I didn't know what an ACL tear was.
Right.
So then, going through the next couple of weeks, like, oh, I need surgery, I guess, to fix this, but I feel okay.
Right.
But until it's a static stabilizing structure is the ACL. So
Yeah.
you wouldn't know that something's wrong because you have your quad, your
Yep,
hamstring,
exactly.
your calves. You wouldn't know something's wrong until you started cutting, running, decelerating.
Yep.
Then you wouldn't be able to do that anymore.
At
So
all.
Do you think that weight, looking at it from today's perspective and standpoint, do you think weight affects lower extremity injuries or no?
So like lifting weight, you're saying?
No, just
Or like
weight,
body
weight.
body weight.
Absolutely. So let's bring it to why people have total knee or total hip replacements. There's a correlation in the literature that says for every 5 pounds of body weight you lose, you're actually decreasing, I think it's 10 or 15 pounds of force through the knee joint.
Yep.
So yes, it does. And in fact, there's a handful of orthopedic surgeons that one of their surgical criteria is that they won't operate if you're over a certain BMI.
That makes sense.
Yeah.
Now, can you explain to the people the difference between contact and non-contact ACL injuries?
Yes, so very common. The stats in the literature, I'm not sure right now, but I want to say it's like 90-10.
Yep.
90 being non-contact. You're running, you're cutting, boom, your knee gives out. You get stuck in the turf,
Yep.
you twist, your knee gives out. That's non-contact. Contact, Nick Chubb commonly in the NFL injury.
Yep.
You're running, you're cutting, you get tackled or hit.
Yep.
Yeah.
Your knee, your foot is planted. You're a quarterback. You're throwing. You plant, and then somebody comes from.
That was
Aside.
brutal.
Now, a perfect example aside from Nick Chubb was a non-contact, the linebacker for the Dolphins. He was pursuing and over-pursued, and you can see him plant, and it was a combo. I guess you can, I didn't really look into it, but you can kind of see the hyperextension, but then you see a collapse of valgus in the knee. And you can hear him scream immediately. So that is where I feel like people don't understand the concept where certain things happen. But there are things that we do here at Xenhouse, and I'm sure you offer these same resources in regards to injury prevention, where you can kind of limit those type of injuries in regards to training for that.
Yep.
And one thing that we focus on here in regards to our prehab work is making sure that athletes understand the concept of controlling the glute, the adductors, the hip flexor, core activation, and how those play a pivotal role in lessening the chances of actually putting too much stress on that ACL to prohibit, ACL injuries that are non-contact.
You're absolutely right. To interject, I think going back to Bradley Chubb, think about the psychology of injury, right? So he was decelerating, cutting. He knew his ACL was torn. So I think it's that psychological piece that let out the scream, like, oh no, I'm missing probably next season. And when you talk about the professional level, there's a financial incentive as well.
So, good job.
Yeah, but to go back to what you guys do at Xenhouse and strengthening your glutes and your quads and your hamstrings, that's very important. And I'm glad you brought that up, because the research, they always talk about to decrease your risk of ACL tears, get the quads and hamstrings, decrease that ratio, because there's a difference between your quads and your hamstrings. Your quads, you have 4 muscles. Your hamstrings, you have 3. So your quads are going to be stronger. To decrease that ratio between the two can significantly decrease your risk for injury.
Now to get
non-contact.
Now to get a little bit in more depth with this, I was taking some courses in regards to ACL prevention and return to sport for the ACL, and one of the things that I've noticed, and which has been told, where females are at a higher rate due to quad dominance. Can you elaborate a little bit more on that and how the difference in anatomy between a male and female plays a role in the ACL?
Absolutely. Great point. There is a litany of research out there that will have a different intrinsic and extrinsic factors with the female athlete.
For sure.
You mentioned being more quad dominant in the female. Yes, there's a Q angle, the way your pelvis angles with your knee joint. That's wider in females. There's a lot of other intrinsic factors as well, hormonal factors that can be tied to ACL tears.
I know there's a trainer that I follow on social media, and she brought up something in regards to the menstrual cycle and trying to see if there's a study that correlates between joint issues, tissue issues, in regards to the female athletes, and if during that week span of their menstrual cycle, if that plays a role, because I guess there's some elasticity during
but
those
there's
times.
a lot going on in the body.
Yeah, there is. But
like
they think if it's higher when there's when they're going through their menstrual cycle, they're trying to figure out, if there is true facts that prove that if they're on their menstrual cycle, their joints are a little bit more elastic. So the chances of injury are much higher than when they're not.
That has been studied for sure, but there's so many other variables. That's one. Right? So let's go back to Bradley Chubb's deceleration injury. Was it because his quad hamstring ratio was off? Absolutely not. Those guys are super strong. A lot of times it's just bad luck, unfortunately. And no matter what we do in the clinic, what you guys do here, there's a lot of things we can prevent, but there's a lot of things we can't.
That's definitely one of my thoughts when even the other DN, when he tore his Achilles versus Jets. I'm like, these dudes are top athletes. They do everything right. They have the best trainers, all of that, and it still can happen to them. There's just some things that you can't control at that point. And I got another question too. What are some of the top injuries for men versus women, or more so in our field, like the high school athlete and down? What's the most common injuries, and what are some things they can do to help with that, to help prevent that?
So with going to injury prevention, there's a ton of variables, extrinsically and intrinsically, with training regimens, different forces through different sports. But the most common injuries that we see, we'll see a lot of shoulder impairments. So whether it's an impingement syndrome or rotator cuff tendinopathy, think about what high school kids are doing often, right? They're in class, horrible posture. And again, these are extrinsic factors. There's a whole textbook on different factors. Bad posture, then they feed into the bad posture by when they're not in class, they're here, they're on their cell phones, right? So there's a lot of things, muscles adaptively lengthen in the posterior chain and shorten in the anterior chain that can cause kinematic faults in the shoulder. But I guess the most common injuries, we see a lot of swimmers and overhead athletes like baseball and tennis.
All the time.
That's a common shoulder injury. And then in the lower extremity, a lot of soccer, lacrosse, football, basketball, like jumping, cutting stuff. You go into
A lot
basketball,
of
there's
these kids too, and we see it often, they're trying to play multiple sports, right? Like I had an athlete that came to me one day after hockey, then came to me, and then was gonna go to another practice after. And I'm like, thank God I asked you what you had going on today, because, you know, for me, like we have a program and I was gonna follow the program. And that day it was just kind of like, all right, you're not running, right? We're gonna focus on injury prevention today, because there's no way you're gonna go play hockey, right? Then you're gonna come to me, we're gonna run, right? And try to get you faster, because that's the most important thing prior to your season. Then you're gonna go run more after, right? Friday and Saturday, you're not gonna be able to do anything.
Right.
Right? And if you have any sort of competitive game or anything like that, it's done. You know, and that's like the higher risk of injury kind of thing. So I know for me, when I was in college, right, I had patella tendonitis in both of my knees, and they would feed me Celebrex. Like it was just like, that was just the thing.
Yep,
right?
anti-inflammatory.
But the most important thing that my PT guy told me when I was at Albany was, he said, Ross, you have two options. I can give you Celebrex, or you can go have surgery. He's like, and I'm like, all right, well, I have no idea what Celebrex is, but I do know what surgery is, right? I don't know, like, what should I do? And he was like, well, first and foremost, you should not get surgery. And that might have been the best thing, like, anyone has ever told me. Because once I realized, all right, like, the only reason I'm having these knee pains is because, first off, I'm playing cornerback and you got me squatting 465. I don't need to be doing that, right? I need to, like, gain more stability and get a better, well-balanced lower extremity strength, right? And once I figured that out, it was just like no more pain.
Yeah, you made the right move, because that surgery is
The worst.
Terrible.
And you had it on both knees, so you
Yeah.
have one anyway. But you're right. I think you guys see in your day-to-day the evolution of personal training and fitness.
Yep.
Right? You have cornerbacks just max squatting all day. Like, how does that translate to their sport-specific movement?
Right.
It doesn't.
It doesn't.
Right? So it's like, now I think as personal trainers and physical therapists, athletic trainers, everybody in your health circle
Yep.
is more educated.
Yep.
And the research is kind of pointing them towards or guiding them to have a better and more appropriate program.
Yeah.
Absolutely.
So you got a guy like Justin Jefferson who went on IR for a hamstring injury. So for an outsider, they see that as like, oh, his hamstring hurt, mine hurt. Like, can you explain kind of something like what actually happened with the hamstring? What
Or the
do you
levels.
think? Yeah,
But
the different
and
levels.
plus, like, he's like at a different level, you know.
Yeah,
like,
but I don't think people understand.
running
They just
routes,
think, oh,
it's
his
just
hamstring's sore,
hamstring.
he should be playing.
Yeah.
So explain like
I
the
think-
levels and.
If we go back to remember when Shaq was playing and he had, I think he had like not a plantar like turf toe. Like, oh, it's your toe.
Oh, it's
Come
just
on.
a toe. Yeah. I had turf toe. No joke.
That's a big toe.
Right.
So think about like Justin Jefferson, if he did a job, if his profession was an accountant, even a physical therapist, whatever his profession is, he'd be fine. He'd tear his hamstring and he could do his job.
Yep.
He's accelerating at crazy rates of speed, decelerating and cutting. The demand on your hamstring, eccentrically and concentrically, and to
Yep.
control that.
Yep.
Because if he got back too soon, if he rushed back because you're in your fantasy football championship and you need a W, he rushes back and he re-injures himself. Then he needs surgery or
absolutely.
Sets him back.
ACL tear.
Tear.
Yep.
Yeah.
Then he's out for this season. Then it affects his pockets.
Yep.
So now we're talking about So let's go back to the different levels of a hamstring strain. Muscle injuries are micro tears,
Yep.
right? So you're gonna tear. So I don't know Jefferson's like level, whether it was 1 or 3, and then level 4 is an avulsion fracture where the tendon actually pulls a piece of the bone. A portion of his fibers in his hamstring are torn.
Yep.
So to accelerate, you have to lengthen that hamstring tissue. And you're just not going to be able to do that because of that scar tissue laying down to stimulate the healing process.
Yep.
But like I said, if he was in a different profession, he'd be
He'd be
okay,
fine.
good to go.
It's just the normal
You know,
idiots.
And then the
you
people,
know.
sometimes people come in here and they just say, oh yeah, I tore my hamstring. I'm like, you did not tear your hamstring.
I hate that.
Yeah,
Yeah.
no, I tore my hamstring
Yeah,
last week.
some-
I'm like, no, you didn't.
Like, come on, what are we
You
talking
still
about?
walking and talking.
Oh, I tore my hamstring yesterday. This is
Yeah.
what someone said to me
They say
like
that
last
all the
week.
time.
What would be your?
Oh, my coach said I tore my hamstring.
Of course, yeah.
A lot of people that don't have the background like to give diagnoses that don't make sense.
Yeah.
And it just causes panic.
Of course,
And then
yeah.
you go on Google, and then it says you're gonna pass because you have a turf toe, and it's
Yeah.
like if you don't get it checked out, you have 30 days to live, and it's like, wait, what?
It
And then
gets extreme.
It gets
sometimes
extreme.
When you,
Yeah.
when you self-diagnosis.
A question for you that I have in regards to fitness and the well-being. How can you? Let me reword this. What do you see in your profession in regards to clientele that come in? What do you see as a big role in the health and fitness, like consumption in regards to food and diet? How do you think that plays a role in injuries with, even just general fitness, not even athletes, just general fitness?
Yeah.
How do you think that plays a role?
Enormous.
Yeah.
It's a humongous intrinsic factor. My wife's a nutritionist.
Yep.
So I'm answering this question cautiously because look at all medical professionals, right? They don't have the proper training that nutritionists do
Yep.
to adequately give advice.
Yes. Yeah.
So you guys see it all the time. Hey, should I take turmeric before bed? Right? My answer, I always defer to, I'm not trained to give
Yep.
nutritional advice. It's actually not within the physical therapy scope of practice.
Practice, right?
Yep.
It plays a humongous role. So one of my jobs is to educate patients.
Yep.
Where can they get the answers to their questions? So my job is to guide them to where they can become educated. So that's kind of how I would answer that. But it has a humongous
Yeah, that's
intrinsic
just want to
factor.
know because a lot of people that we talk to, they ask us these questions, and I don't give them an ideal answer. I just say what works for me, but what might work for me is not going to work for you.
Correct.
We may have to call your wife though. Dudes got to get checked out. You feel like you're in a good BMI space or no?
I feel like I'm in a great BMI space. I'm getting back to the old college days.
Yeah.
Athletically.
So you shredding some fat,
Yeah, I'm back.
getting in. Where you feel like you're at, Alex?
I'm getting there, but I still move like a beast.
How much you weigh right now?
I'm 260.
What?
Is there anything you could do?
Alex, you're 260?
I'm 260. I still run faster than most of our high school athletes, most of our college athletes. I will route anybody up. I will lock anybody up. I'll outwork anybody that wants to step in front of me.
Nah, yo, we gotta help, buddy. Can we call your wife? Can we call Mrs. Shannon?
You ain't gotta help me.
what about Aaron Donald? He's pretty big and he's very agile.
But
a
this
beast.
is another thing that I want to bring up. This is a different field for both of us, but at the same time, we're all in the same field. The number is a false advertisement. I try to tell people, especially my female clientele, don't step on the scale. It's a liar. That's gonna make you panic and think, I need to eat salad.
Yeah.
I need to skip a meal.
Right.
And you just you think of a number and you think, okay, I'm 260, so I go based on my clothes and how I physically feel.
Yeah.
I actually feel more mobile now than I ever have because I've been doing mobility work. I've actually been eating much better. I'm on medication. I think that plays a huge role. I know these guys are talking junk.
He always, we know,
I'm gonna go.
you got grades,
I can't take this.
I'm gonna go back to that every time because
It always comes out.
when I wasn't on the medication, how skinny was I?
Nah, you look sickly. Like
But
it was
when
bad.
But when I got
It was bad.
no, it was bad.
I got Snapchat videos. I'm gonna send it to
Okay.
you. You
It
gonna
didn't
see.
show
look
you what
bad,
it used to look like.
But the medication that I'm on, it suppressed my appetite, but at the same time, I've just started gaining weight like that fast. I'm still on the medication now. This is year 3, and I still can't eat how I used to, but I keep gaining weight, and I'm just like, I don't feel the weight. I'm still moving. I just started running, and I felt great running. I had no issues on the knees. The cardio, yes, I felt that. I'm squatting. I'm doing all the things that I was limited to before in the past that I had knee issues because I wasn't stretching. I wasn't taking care of the body. But again, I go back to the number. The number is false advertising because as a former high caliber athlete, you look at people like Aaron Donald, who was he, 280? 270 something, and he could run a 4.6.
Yeah.
The book would
And-
say that's not
Yeah,
correct.
and
Yeah.
if you do BMI, it'll say he's obese. He
Yeah.
is.
Yep.
For sure.
But again, a lot of those factors, they play a role in society because they think this says this, I can't do this.
Right.
For me, we're always going to compete. The three of us, we always compete. It doesn't matter. I can be, I mean, if I was 280, then that's a really different story. But for me, if I don't feel like I can do that stuff, I'm not going to put myself in that situation. But I know I'm not eating terrible. I eat bad,
Yeah.
but I'm not going to tell people like, you can't do this, but I'm lifting to burn and kind of counterbalance.
Manage.
I'm doing the work, but most people aren't doing the work. They're just doing the worst part. And then they go to, oh, let me go see this doctor that's going to give me Ozempic and not know what's going to happen later on. And now you're in a whole different world that you just set yourself up because you didn't want to.
You mentioned how you feel.
Yeah.
Right? That's the
That's number
big.
one.
Yeah, and I would agree. You know, your weight is one variable. How you feel is another. We could spend all day talking about the psychology of fitness and injury and exercise, and very important.
Yeah, I think
I
it's
got
huge.
a quick question. So, you tore your ACL. I've broken my tibia. He had an Achilles injury, tendonitis, hairlines.
All right,
broken.
that's you too.
Go to yourself.
Hairlines broken.
Go to yourself,
So
too.
I tell you that we all experience some injuries, more than others, right? So as a PT, do you have to kind of go through something to be a PT? Do you know any PT that haven't had injuries?
Good
How does
question.
that work?
I
Yeah.
would say the majority in my arena in the orthopedics and sports clinics have had some sort of injury or have had to deal with some sort of injury, whether it be a family member, them personally, or just like being around somebody who's rehabbing an injury. Because it's powerful, right? Like you go from your Achilles walking on crutches and non-weight bearing for 6 weeks to, you know, back to running and squatting and things like that. So it's to be impaired and debilitated for so long,
Right.
and then seeing the other side of things, that's very powerful.
Yeah.
I just to kind of in a different world, but I kind of go back to Goggins. I've been listening to Andrew Huberman. I don't know if you're familiar with him, but he had Goggins on there, and Goggins goes into depth about how when he was fat, right, and how he felt useless. Like he didn't feel like he was living every day like it was gonna be his last, you know, like he didn't have any benefits to him being big. So one day something just snapped, right? And he said all the things that he said, I don't curse anymore. And he said all the things that he said, and it just changed him. And now that he's the guy that pushes and motivates people, right? There's nothing that makes him want to do it besides him feeling great, you know? And he looks in the mirror every day and it's him versus him.
Yeah.
And he feels great. And he continues his day just like that.
Yep.
So
I think it's that time.
It's that time.
We got questions. I'm gonna fire some questions at you,
Boom.
and you just answer to the best of your ability. So you said Willis McGahee earlier. It's funny because I was gonna ask you, what's the worst sports injury you've seen on TV between Willis McGahee and Sean Livingston?
Oh yeah, Sean Livingston
That one was
bad.
wicked.
Yeah, I mean, so great question. It's tough because now the broadcasts are cutting away.
Right.
I think one of the most powerful things I've seen on TV is Damar Hamlin on the Bills, because most people didn't know, but I had a feeling he was essentially dead on the field,
Right.
And had to be revived. That's some crazy lightning strike type injury.
Yeah.
But I'm watching that, was it Sunday, Monday Night Football with my wife, and
Sunday.
I'm like, oh, like they stop a game. How many games have you watched that they've actually stopped the game?
Yeah.
Which is insane, especially in the NFL. They don't
Yep.
do that.
Right.
So I think that was the most powerful one. But like gruesome wise, the kid from Louisville basketball,
Yeah.
Kevin Ware.
Yeah.
Oh
I
my
forget his name,
gosh,
but
I
When he
forgot.
jumped and he had like
landed.
he had the open fracture tib fib.
I
Yeah.
forgot about that.
So you had a tibia fracture,
I had
right?
a tibia fracture.
It wasn't open like the Dak Prescott or.
Well, I landed like this. I was doing a backflip, a full twist, landed like this, snapped it, and I was in shock. I got up and tried to walk. So it made it
yeah.
worse. Couldn't walk for 3 months.
And Alex Smith
That's funny.
too.
Alex
Yeah,
Smith.
Smith was
Yeah,
rough.
that was Alex.
So
Yeah.
Alex Smith actually, the fact that he's alive,
He should've- yeah.
is amazing
Yeah.
because he developed an infection.
Yep.
Yeah.
Because your bone and tissues are exposed to the environment. They're not
They're
supposed,
not
to
supposed
be.
to be. Yeah.
Right.
And yeah, he had multiple surgeries.
Oh.
And those are the things, as a fan, you don't see that stuff.
Every day. Yeah.
So I would say probably those
One-
few are
those
those
few.
That
answers.
happens though, like the whole cardiac arrest with Damar Hamlin. I was watching. I don't know if you guys watched the whole Lions thing with the greatest running back to ever do it, but he had one of his teammates pass away the same way as well on the field. But like when you start going back and you research, like it's happened.
Yeah.
I think it was such a shock to us. Everybody was just
Well,
like,
it's
'Cause it's probably
happening
literally
live
live
too.
on
no way.
TV, yeah.
Yeah.
Next question. If you can go back and give your 18-year-old self one piece of advice, what would you tell yourself?
Wow. Great question. We ask this actually a lot in people who are like high school students who are choosing like which career path they want to see. I would say like quality experience is super important. Kind of dip your toes in everything. See what excites you. See what interests you. To kind of see where you want to go with yourself to make a change and impact
Yep.
people's lives.
absolutely.
What is one common myth associated with being a physical therapist?
I would say most people are turned off by physical therapy because they think we're just going to cause pain. With rehabbing an Achilles, rehabbing a tibial fracture, patellar tendinopathy. And now, like even a knee replacement, right? Most people are like, oh, the rehab's so terrible. And like, we don't want to make it terrible, right? Our goal is your goal.
Right.
So I think like when I was on the table as a patient, it was like every day was an objective. Andrew, you have to get to 120 degrees today. I won't tell you what they had to do to get that, but I was strapped down to a table for them to bend my knee, and I hated it. I hated physical therapy.
Yep.
So I think that's a myth, right? Like we don't want to cause pain. We're trying not to cause pain because actually there's research that says if you're causing pain, you're resetting the inflammatory cycle comes
Right.
back and is a detriment.
Yep.
So I would say that's
Can I
the
throw
myth.
something in real quick? With me personally, when I had to go through with my Achilles, working on the range of motion was terrible. The Graston, terrible. But I started to feel that they were limiting me. So I wanted to get out so fast. I started running in 3 months after my surgery. My surgeon was in awe. He was just like, wait, what? and I showed him my video of me sprinting. And he was like, what have you been doing? So I got in the pool once my stitches cleared up and I worked on my range of motion, all that stuff. But I personally felt like the PT that I went to, they were kind of babying me. And I feel like a lot of people have that myth that I speak to that, you know, PT babies you. And they kind of like, oh, let's take your time, don't hurt yourself. But for me, I was, you know, I'm not comparing myself to no Adrian Peterson, but, you know, I had that mindset where I was like, I need to get out of here and get back to moving.
Right.
So I feel like some athletes and some people have that mindset, and it's kind of, you guys are that bridge between babying, but also you're going to push you, but make sure, you know, your name is online and so is their well-being. So you have to, there's a fine line that you can't mess
There's
with.
gonna be a little pain. Like you're going from literally having something that you've never hurt ever to completely torn, and now you're trying to get it back to where it used to be. Like there's gonna be a little something that, as long as you don't like mess with the inflammation, like you were saying.
Right, and you're respecting tissue healing timelines.
Right.
Right, like you're not gonna be running in 4 weeks after an Achilles reconstruction because your tissues are just not healed.
It's not possible.
So I would say that's a great point, and you guys see it in your line of work as well, where an athlete will come in, hey, I need to be pushed more, which I almost guarantee they never say. But it's common that if I have the conversations, I have an open line of communication with my patients, say like, hey, if I'm pushing you too much or not enough, you have to let me know. But we're always going to respect the surgical timelines and the healing timelines, because we're never going to do something too quickly to put too much stress on the surgical site.
Right. So with my fault, Des. With Alex is like an outlier, and probably a lot of people, right, as far as like percentage goes, with people who are running 3 months after. Have you ever seen like a re-injury because someone just thinks they're, you know?
Yeah, so re-injury might not be a result of another Achilles tear, but a re-injury can be like hip impingement or something that one joint above or below wasn't cleared to be able to perform this demand so that a resulting another injury, a concurring injury can happen.
Right. Yeah, because I just had someone who hurt her tibia, and she just thinks that, you know, her right quad, she hurt her left quad, and she thought that it would be the same as her right quad. I'm like, well, when you take off the boot, all right, there's gonna be a lot of things that are a lot weaker, right, compared to the other side. So like, it's gonna take time. You know, you just can't go right out and start playing soccer, tennis, and doing et cetera because you have the boot off, right? It's a process. So,
and there's a litany of athletes that have come back too soon and re-injured something, or like I'm trying to think off the top of my head who came back too soon. But if you had like a shoulder injury and you're a quarterback and you came back too soon and you develop like a hamstring tendonitis or something. So,
well, I was gonna tie off with what he said about Adrian Peterson. How do you deal with someone like that who every timeline he was given, there's a whole, like a doc about when he tore his ACL and came back and won MVP the next year. But someone that, let's say the doctor said, you're not walking until this day, he automatically in his mind was like, no, I'm not gonna do that day, I'm doing a week before. How do you deal with someone that's different mentally that,
well, I think we all have that, like a little bit of a capacity. Think about you're going somewhere and you have the GPS, and GPS says, we'll get there at 10:03. Hell no. Right. I'm getting there at 9:53. Right? So same thing with timelines, right? Adrian Peterson, and you guys have this conversation with your athletes, and we have the conversation with the patients. Oh, well, Adrian Peterson and Aaron Rodgers did it earlier. Well, they're like genetic marvels, and they can do things faster, but they respect the tissue healing timelines. I would say that give them the realistic expectation so that they're not disappointed. And if they do heal at a faster rate, then they're rewarded for that.
rather than be disappointed.
Correct.
What do you think that process is, right? Well, I would say the reporters were kind of hyping it up. We knew he wasn't going to play this season, but I think there's a lot of normal people who were just like, okay, like Aaron Rodgers has a shot to come back. Guys, no, he doesn't. It's not happening. What do you think they were doing, like those doctors, to kind of get him to be on the field to even do dropbacks?
Yeah, I mean, well, he had a, I think probably a different surgery than what you had,
Yeah,
right?
I had the bow weave.
Yeah, so his surgical technique was a little different, which allowed for him to weight bear earlier and hit those timelines earlier. So Aaron Rodgers was probably running at 12 weeks. But I would say that I don't think they were doing anything wrong, but it's
Right.
all about perspective, right? As a
Right.
fan, as a Jets fan, you want them to make the playoffs, you want your savior to come back and play. And we knew in the healthcare industry that he wouldn't be ready, but and maybe if the Jets are playing today, maybe he is the quarterback.
Yeah.
I don't know. Is it a little too soon? Yeah, probably. But with everything adapting, with better surgical techniques, better
Right,
rehab,
right,
better.
right.
So it's not going to be. Think about back to the 80s and even early 90s with an ACL. You
Yep.
were locked in a cast, not a
For-
brace, a cast,
cast, yeah.
for like 8 to 10, 12 weeks.
Right.
So now things are going a little bit quicker, safer.
Right.
More efficient.
More things are involved in the rehab process, nutrition,
Right,
sleep
right.
hygiene, right?
Yep.
We could talk about this all day.
Right. Right.
So many factors.
What's the most important lesson you've learned in your career so far?
Oof. Do I want to be politically correct with this one or not? The most important lesson.
Whatever you want.
Yeah.
Wow. I don't want to be cynical with this.
Nope. Get it out.
Say it.
Well, I've learned a lot, so I can't just answer just one. I can't give you one answer, but the first one that pops to mind, and I hate myself for saying this. Everybody is replaceable.
Yep. Don't hate by telling the truth.
Yeah. That's real life. That's real life.
And that's kind of what I'll tell my mentees. My younger sister's a physical therapist, and we have the conversation. You know, what we've done to get to where we are with our education, with our experience, it's a lot. We don't get to where we are by waking up every day and putting in minimal amounts of effort.
That's a true fact.
But at the end of the day, everybody's replaceable.
Yep.
Aaron Rodgers tears his Achilles, and imagine if he's like, that's it, I gave it my best shot. You think the Jets stop playing football? No. They find another quarterback, right?
That's it.
Just like in everybody's line of work.
Yep.
Police officer, accountant, anything,
Yeah. Yep.
anything, right? Like, oh, I'm done with this. I don't want to work hard anymore. I don't want to work to get better. See ya.
Next.
Yep.
Last question. When it's all said and done, how do you want to be remembered?
In my career and life.
Life.
Both.
Oh,
Both.
Yeah, let's hear it, Dad.
all right.
Let's hear it, Pop.
All right. Well, life. I mean, I wasn't expecting to get this deep on a Sunday, but just someone who has compassion and you want to be a role model for your kids and your family, your wife and friends. And I think that at the end of the day, I don't care how other people perceive me, but how your inner circle and your family perceives you. Can someone go to you with advice and expect the truth, right? Like, what's the best piece of advice? You're replaceable, right? So that's the truth. And common sense is not so common anymore, right? You want to teach your kids and teach your friends that, oh, you see an empty water bottle on the floor, pick it up.
That's
right?
it.
There's an empty grocery cart about to crash into Alex's Ford Mustang, pick it up,
Yep.
right? Put it away. Things like that, those innate qualities that can't be taught.
Yep.
That's something that I kind of hang my hat on at the end of the day.
Like, you didn't have to bring those cinnamon rolls, but you did.
That's right.
Like that.
And Alex is gonna kill him, right?
By himself too.
Nah, that was dope, man. That was awesome.
You want to share with people how they can get in contact with you, and if they
Yeah,
want.
absolutely.
IG
Well,
handle.
IG, this is your camera right there to check into.
Yeah. I'm Andrew Shannon, physical therapist at HSS Sports Rehab at Chelsea Piers. We have our website through Stanford Hospital. You could find me there, and my kind of like personal Instagram. I like to work-life balance.
I was going to say,
like
you cooking, tell them you're
my
cooking.
My life is up here, and I think if you want good recipes or
let them know,
you want to talk about cars or bourbon or beer, like I'm your guy. I'm your guy.
Yeah, you got a little hobby. You like to make some good food. You like to smoke and bake and do all that stuff. So
Well, you got to be specific. You're not smoke. Bake what?
Using a ceramic smoker.
I'm not saying what exactly.
Come on,
He's talking about the green eggs.
The green eggs. I wanted him to explain that. I wanted him to explain that. Sorry, I want him to explain, because if I said everything else, everybody would be like, whoa, pause.
Yeah.
So relax.
I'm just saying, smoke. He like to smoke and bake. That's what you said.
That's it. Yeah.
All right, we're not talking about marijuana, guys.
Nope.
But yeah, Andrew, we
We
appreciate
you
man.
taking the
Thank
time
you.
to come see us.
Yeah,
man.
this was awesome.
Appreciate
This
you
was awesome. Thanks for
coming by.
inviting me.
Episode 58. We're signing out.
Signing out.
Peace.
It's your boy Ross B. If you enjoyed today's episode, please be sure to subscribe, like, share this Xenhouse podcast. We're also available on YouTube, Spotify, and Apple. If you have any feedback, please be sure to drop it in the comment section.
Xenhouse, yeah. Xenhouse, yeah.